and thank you so much for coming today.
And all the attention is going to be on you. Are you ready for that? Are you ready for people to say, over and over again?
Thanks for coming.
Yeah. What's going on, family? You know who it is. Monica Sekhmet Grant, Young Boss Media, coming live from the bathroom. Just like BET, live from the basement. We in the bathroom. What's going on, family? It's your girl, Monica Sekhmet Grant, and we are back with another interview for Mentorship Call. Now, the purpose of these calls is to make sure that you are meeting so many unique, beautiful people all around the world that's going to bring you into their life, into their career, so that we can all be exposed to different industries, different opportunities. You never have to be in a box. And so the purpose of these mentorship calls is just to go anywhere and everywhere where we can find unique conversations to have. Now, before we get started on this conversation, I hope you all have gone to youngbossmedia.com and ordered your copy of Mind Your Business and Prosper. It is now available for global release. If you are in America, you can purchase it online off the website. You can go to Amazon. But if you are international, please go on Amazon. They have the best shipping rates for you. This is the book right here. How can I bring it up? That's the book right there, Mind Your Business and Prosper. It is my fourth book. We just released it on Monday. It is an autobiographical self-help workbook, particularly for young entrepreneurs and aspiring entrepreneurs to learn from all the mistakes and lessons that I had to learn the hard way. I didn't necessarily have all the mentors that are available now in entrepreneurship. I had to bump my head a lot of times and figure things out. And so this book is for, the aspiring entrepreneur that wants to skip some steps. And I'm willing to allow you to do that because we need to make sure that we are making the most of our life and our time on this earth. So learn from me, skip some steps, get Mind Your Business and Prosper on youngbossmedia.com, or you can go to Amazon, particularly if you're international, to get the best shipping rates. Now, on today's show, we are going all the way to South Africa, and we're going to speak with a global surgeon. She's a professor at the University of Cape Town. She is an OBGYN. She is an advocate for women's health. She does a lot of things and just very impressive resume. And really, I just want to know, how do you do it? How do you do it, sis? We're always talking to these amazing women. So I'm going to bring her to the platform. Her name is Salome Maswime. I hope I said it right. Welcome to Mentorship Call. How are you doing?
I'm good, Monica. Thank you so much for having me here today.
Oh, you are so welcome. You're so welcome. Thank you for all the work that you are doing for women, for women's health. I appreciate you.
Thank you so much. Thank you.
You're welcome. So give us a quick background as who you are. Introduce yourself to the audience.
All right. So as you said already, Salome Maswime from South Africa, and I'm an OBGYN first, but I'm a mom, I'm a wife, a lot of roles that I play. But essentially, I'm a medical doctor and I'm also an academic. And so my background is, I qualified as a doctor a couple of years ago. I specialized to become an OBGYN. And part of my journey was really realizing that there's so many health disparities and differences in health outcomes across different parts of the world. So a woman in one part of the world might survive a life-threatening complication from childbirth, and a woman in another part of the world, won't survive even a simple, complication. And so my journey was really, I think it really began after I specialized and seeing, looking at work into cesarean sections and seeing how some of the women in Africa were dying just from either not having access to cesarean sections or from having complications related to cesarean sections. And that, led to me doing my PhD. A lot of opportunities opened. Spent a year in Harvard at MGH doing a global health fellowship. And from there onwards came to Cape Town. And recently, last year this time, started my new job as head of global surgery.
That's impressive. You said Harvard. You said a lot of things, and you're an award winner. How did this start? What made you go down this lane? Because you didn't just you're not dabbling in medicine. You are an expert of the field. So where did this all originate from?
So I guess a bit from childhood, and so I think we grew up. My father was an academic. He's a professor of theology, and so we grew up sort of very close to the university, and always meeting academics. Graduation time, my parents would take us for graduations and just to be there. We knew no one, but we just had to be with them. And so I think that desire to become an academic was really strong. Of course, I then decided I wanted to do medicine, and I didn't know where I would end up with it. But even whilst studying medicine, there was always that thing at the back of my mind, like I want to be at the top of my game. I want to be an expert. I want to become a professor one day as well. And so I think that was the first fascinating thing about my journey. But of course, even practicing and working as a doctor, that's where I realized that it wasn't enough just to be working in the hospital and sort of someone is sick, do this, women are pregnant, look after them, delivering babies. I just felt there was a lot more that I could contribute. Some of the management that, you learn, some of the things I had questions. I was like, should we really be doing this? And so I realized it would only be through research that I'd be able to contribute and perhaps change how certain things are done. And so it's a whole journey from childhood mixed with other things, but eventually leading to where we are now.
That's beautiful. I love hearing how your family just supported you, just with education. It's like, this is just what it is. This is the family thing. We are educated people. And so immediately you took the baton and just ran with it. I love that. Tell me this, in your journey in medicine and women's health, what have you discovered? I know we don't want to get too technical in medical, and we're not diagnosing anybody on the show, but what have you learned about women's health and the disparities maybe in like Europe or America that you might see somewhere else?
Yeah. And so the big thing from our studies was just the likelihood that women in Africa are 50 times more likely to die from cesarean section complications. And so often when we read about, things like cesarean sections, a lot of media stuff gets reported from what happens in high income countries. So I would speak about the fact that African women don't have access to cesarean sections, but, all the reporting says women are having unnecessary cesarean sections. And so, it was coming from that point of saying, surely we have to advocate as well, and tell our own stories. But later, deep into the research, finding that, women are really dying from complications and things that could be prevented, but it's really related to health systems and leadership, a lot of other things that happen outside of the hospitals where politicians come in, policymakers, stakeholders. And so my journey to global surgery as well has been that global surgery is about improving surgical outcomes, but looking at populations, working with stakeholders and creating partnerships with people that can change how things are done. And so, that's what it's really been about, moving outside of the hospital to look at what can be done better to improve outcomes inside the hospital.
Got it. So we're not going to get political either. But in a perfect world, what would women's health look like, and how can things be improved?
So in a perfect world, no one will be afraid of childbirth. Women will not, in some cases, childbirth or cesarean sections look and feel like a death sentence, and at a time where women should be celebrating and having a special moment, women come across a lot of interesting things. So from disrespectful maternal care, women being shouted at in labor wards and just being undignified and ethical in the way healthcare workers are treating them, but also having outcomes that could be prevented. So some of my work looks at stillbirths and how can we prevent women from having stillbirths. an area, of course, a lot happens, a lot can go wrong during pregnancy. So I'm by no means trying to say, let's solve everything so that no one has any bad outcomes, but let's at least try to strengthen our health system so that we don't have preventable deaths, mother and child.
Wow, this is interesting. I'm not sure how many people know, outside of America or Europe, know what African women experience in their health care. Can you just take us through, like, outside of just giving birth, what does the healthcare system look like on the continent?
Yes, and I mean, even within our country, even within the continent, there's a lot of disparities, and a lot of it, goes according to wealth. If you can afford good healthcare, you'll go to good hospitals, you'll have the best healthcare. But there are women who cannot reach the hospital, because of the roads that are there. Meaning, if you go into labor, it's going to take another 3 hours, for you to get to the nearest hospital, walking across a mountain, there aren't enough ambulances. So I don't want to paint a really bad picture of what happens, but I want to highlight is that there are real disparities, even in across the continent. There are 5-star hospitals where you get the best care, but there are also places that need a lot of attention. And I think the governments, the public health sector is really there to try and ensure that women have dignified care and receive the highest quality of care that they can. That it shouldn't just be about how much you can afford, but at least basic care can be provided for every human being.
Yeah, that's extremely important. Can you speak about your role as, and it's World Humanitarian Day. How are yourself and others working to create that situation for women to be able to feel comfortable giving birth and going to the hospital and feeling safe?
Yeah, so I mean, a lot of my work has been through research, and I realized that I needed to have data and numbers, and not just to be a voice, but rather to do my own research that I could speak about. And so I'm involved in a lot of committees, national, international. I've played an advisory role, consultant role on various bodies, and I find that to be important. Whilst as a clinician, as a doctor, a lot of the work we do is inside of the hospital. But I would go to WHO meetings and find, I'm the only person from Africa in this meeting, and important decisions are taken, how things will be, important, and some people have to be there. It's not just about being at the bedside and helping the patient that's in front of you, but we also responsible for generating knowledge, for advocacy, for leadership, and so I've tried to play many of those roles. So my early career was really as a clinician and literally working in one of the biggest hospitals, in fact, the biggest hospital in Africa, third biggest hospital in the world. So it was a really busy maternity labor ward. It was an amazing experience. But, my career then moved into issues of policy and advocacy, because I felt I could play an important role there and not leave things to chance. But I felt, I could add my voice to some of the decisions that are being made.
Right. So here in America, or just other places, but here particularly, when we think of advocacy, we think of people being on the ground, organizing their community, going out to speak to their politician. Are there movements of African women on the ground pushing for policy change or pushing for healthcare development?
So in certain sectors, so the answer is yes, but in certain sectors, it's for example, with the HIV movement, there was a lot of advocacy that was done, and that resulted in a lot of positive change. But in certain areas, for example, there isn't enough advocacy for pregnancy, or for good pregnancy care, or for surgical outcomes, and often I think there's always that notion, or people don't always question, for example, when things go wrong, could something different have been done? Could someone have done something different? And it's important, and for us as women to have a voice and to advocate for change, but also to educate ourselves. I find that, and also, which is part of my journey, why I speak about some of these things, because I realize that a lot of people just don't know. There was a time in South Africa when I started doing my PhD, the number of women who were dying from cesarean section complications was actually quite high, and it was quite alarming for the country. And so there were a lot of calls to see what could be done to reduce this. But people didn't know about it, and so I would say I'm doing this research, and people would be, but why is it important? And that's where you realize that certain things people just don't know about it, and some of us need to talk about it and educate the communities about it and lobby together. So there aren't enough lobby groups on issues like this, but I think there's a lot more awareness and more people starting to think about this.
That's great, and hopefully it just increases, because we don't want babies to stop being born.
Yes,
we don't want that at all.
And it's not going to stop happening. So we need to improve the care. And I think something else that I also need to mention is like contraception and the unmet need for contraception. So on the other hand, you've got other issues as well, and women who don't want to fall pregnant, but there's a lot of issues as well on unmet need for contraception, and there also isn't enough advocacy for such things. So it's just broadening the scope on women's issues.
Awesome. Okay, so just to piggyback off of that, is there I guess you're saying there's not enough movement around contraception, and so I imagine there's even less for like women's contraception. So minimal, right?
So I mean, and these are often things that I don't know. These are often things that in our context we probably don't talk about enough. And I think what COVID has done has been it has brought a disease into our homes, so that we can, in a way that we can also start speaking about it. And I think even in Africa, just seeing people taking so much interest in how the disease should be managed, what are the scientists saying, what are the frontliners saying? And I think it should really be like this for other diseases as well. And it shouldn't be, let the doctors think about it and we'll just, we'll see what happens. But people should take more interest in healthcare issues as a whole.
So you went right into my next question about COVID. How has COVID impacted women's health, particularly what's it like to give birth during this time?
So I'll give so I'll give quite broad answers on that. And I think one of the things, with the lockdowns and at the beginning, a lot of pregnant women afraid of going to the hospital, not sure, you don't want to get COVID. And in some countries where the message wasn't clear, should pregnant women still go to hospital or not? A lot of people were told, stay away, the surgical operations were not being done. So I think it affected a lot of pregnant women just not being sure what to do. And then a lot more anxiety, pregnancy on its own is scary. There's a lot of anxiety, but add a pandemic to that and, just you can imagine women just not sure that, am I going to get through this pregnancy? And if you get COVID, a lot of questions is, am I going to, also, should I breastfeed? Should I not? Husbands and wives being separated in hospital, the husband is not allowed to be there during a delivery. A lot of hospitals made such decisions. So a lot of mental health issues, I think, for women around that, but also reduced access to services from contraception, fertility services, all the usual things that women could go to for the hospital, they have not been able to get. And there hasn't, in many countries, there hasn't been really clear messages on what's accessible and what isn't during this time. And then, of course, women being, having to work from home and juggle and looking after kids. I think it's been a very challenging time for women as a whole, for everyone. But I think women have also had some special challenges during this time.
Now, I mean, you're not exempt from this. You're a woman. You're on the front lines. How is your mental health? How are you dealing with all this? I know you're a tough cookie, but you're human. How are you dealing with this time?
So it's been interesting because so I'm a wife. I've got two sons, very energetic boys. One is 5 years old. One is 8, and they had to stop school, and I had to teach them, basically, and I mean the schools did provide the material. The schools did, but you can't say to the child, go sit there and do your work. You're part of the class, you're part of the work. And so I had to juggle all of this whilst doing my meetings, my Zoom calls, whilst trying to do my work. I'm doing COVID response, in general on one hand, and I'm also having to be a full-time mom as well. So it's been a challenging time, but I think, I would say overall, I think my mental health has been fine. There are days where I feel like, what, I'm not coping, I can't do this. And there are days where it's like, okay, let's keep pushing. It's fine. So it's been interesting. I haven't had the help, in South Africa. Many of us have got, people who help us in our homes to, cleaning, cooking, all of that. And this time meant that I don't have additional help, and I have to do everything, and so just a support network, helping each other with my husband, getting things done, and some days saying it's okay, we can't, it's okay if the dishes are not washed, some days you just have to I'll do what I can, and cooking timetables, all sorts of interesting things, but we've tried to cope through it all.
Wow, well, I'm glad you're making it, you're surviving, and still being able to help others. So, Young Boss Media, my company, as well as this program, we focus on the range of like social entrepreneurship, right? So the activism and being your own boss and creating your own destiny. For some of the issues that you just mentioned, as far as roads or maybe not having the vehicles to get to the hospital, where are there opportunities that you see that an entrepreneur can step in and create solutions or provide solutions to help women's healthcare?
Yeah. So in the global surgery work that I do, so we do research, we do education, but we also do implementation. And so this implementation looks at practical things, projects people can do to improve things. It's innovation, basically, a lot of health innovation. And so I get contacted by a lot of people with startups, and they've got amazing ideas. They want to partner with us and do things. And, I'm always happy to have these conversations. A lot of the things need additional funding. So it's not as simple as bring an idea and we'll run with it. But we also need to think carefully, who's going to pay for this, who's going to, and who do we need to approach to make these things happen. But basically, we need innovators, we need people in business, we need to partner with business people. And also from a social responsibility perspective, the other end, we also need givers to fund some of the work that we do, and people that will trust us as well to carry out responsible projects that will improve outcomes, women's health outcomes.
Awesome. So all you entrepreneurs out there are opportunities to help the world and make some money, but definitely there's problems that need to be solved. And we always say, if you want to have a long-lasting business, you have to create value. And there's an opportunity to make a humongous impact right here in women's health. So you don't always have to have a t-shirt company or a barber shop. There's other ways to be an entrepreneur. Now, what does it mean? What the space of global surgery? What does that mean? Can you break down that role for us?
Yes. So like I said, global surgery, it's a broad term for it's looking at surgical disparities across the world. And so my work originally, because it was on cesarean sections, and I'd already started kind of all of this work on disparities, I happened to be a good match for what the institution was looking for. And so global surgery really speaks to improving surgical outcomes, reducing disparities in surgical care, and the same issues that I've touched on, except, the problems are not just in women's health, but, there's a lot of issues of not having access to surgical care across different disciplines. So whether it's cardiothoracic surgery, it's neurosurgery, across the different surgical disciplines. So it's a multidisciplinary approach to improving outcomes for basically any surgical disease, and also looking at preventing surgical diseases. And so issues like reducing the number of deaths from trauma and injuries, so it goes beyond just looking at the surgical patients inside the hospital, but how can we reduce, some of the burden of surgical diseases? Yeah.
Are you also dealing with female genital mutilation?
So I don't have a project directly related to that. It's obviously something that would be close to especially in our context. It's definitely something that would be important. But, we often go with, we set priorities, and, our key priorities, of course, have been, pregnancy, cancer, reducing deaths related to cancer, pediatric surgery, and issues around, babies born with abnormalities, and ensuring that they have access to surgical care, early on at birth, for example, and trauma and injury. So, but a lot of things depend on, people approach us and say, these are the things we would like to work on. And when it aligns, we pay attention and we partner with people, and not only in Africa, we partner with organizations outside of Africa as well.
That's awesome. Now, when it comes to just surgery, here in America, we have a healthcare system, right? Where, either you get a plan and you pay into the plan, or you're on Medicaid, but there's a system to pay for it. Does that exist in South Africa? Where is there insurance companies where you have an insurance plan, or are you paying out of pocket?
Yeah, so we've got health insurance. We call it medical aid in South Africa, and it's really, it's high end. It seems like something that just about anyone can afford, but in reality, it's about probably only 30% or so of South Africans who can really afford health insurance. So everyone else then goes to the public hospitals. And well, in South Africa, I think the nice thing or the fair thing is if you go to the public hospitals, you're not expected to pay out of pocket. Whereas in other Africa, there are some African countries where you have to pay out of pocket even in public hospitals. So it varies by country. But in South Africa, yes, we've got both sides of the coin.
That's great. So a woman that needs some type of procedure can have it no matter what her income is, for the most part.
Yes, yeah. So the issue will really be, and it's issues around, a lot of the patients then end up in public hospitals. And so the number of patients or with a certain disease versus the capacity that the hospital has to treat them, it's issues around that. And so having patients who might have to wait long for an operation that they could have had earlier, and because there just isn't enough capacity to treat them because of the numbers, the differences between the numbers of doctors and healthcare workers on the one side versus on the other side.
Got it. Thank you. I like to think about the future, particularly how it relates to like technology and industry. In your field, how do you see technology evolving in the next 10 years? Because technology is quick. It's evolving every 2 months. How do you see it evolving in the next 10 years to actually benefit your industry? Like, what things are you looking forward to that will actually help cesarean section surgery or just other things? How do you see it evolving? And because also that's an opportunity for people to invest in the future. If I know this machine will be helpful in 10 years, I'll start, investing there now. How do you see it evolving?
Yeah, so I'm very big on innovation, health innovation, and so even now, part of the COVID projects that I've done, we as part of teams that created 2 digital apps, and one was a contact tracing one, and the other one was an information on COVID app. And so I like to partner with people, with companies that are in that space and doing that. And I think we come on as knowledge partners, understanding what the need is and how this is the need. And this is what the community, this is what the patients need to get. You've got the digital, the digital know-how to, etc. And we partner together to do that. I've also been involved in a telemedicine project that we hoping will start in the next few months or so. And so these are very interesting ways. Health delivery is changing. It's evolving, and we need to keep up. I think I think a lot of people have been afraid that digital health, etc. It's going to replace the work that doctors can do. But I think especially with COVID, it has highlighted, important spaces where we just need to be responsive. And so I also work closely with the biomedical engineers who create devices. And so we're in a space where we can see where the needs are, where the gaps are, and sitting with people that are doing this for a living, engineers that are creating things, we're able to advise that this is what we think we need, and they can then go to the drawing board and see if they can create something. And so one of the interesting things we did recently was we partnered with them in creating face shields, just for the doctors and for anyone basically. But I mean, from our side, we were interested in how long the face shield is. So if it's too long and somebody's wearing it in theater, then it's uncomfortable. It now moves into your sterile space, and so just being able to give that advice and be part of the creating of interesting and important and useful things.
Awesome. I love the fact that you're down to earth, you're easy to talk to. I think this will inspire other people to say, I want to be a doctor. So what does a person need to do to follow in your footsteps? Like, what's the path to victory?
Yeah. So it's, I mean, and it's easy question, but also difficult question because, as you can see, my career has evolved so
Yeah.
much. And so, it hasn't been a straight path at all. And I mean, becoming a doctor, I think that's not the difficult part. You need the passion, apply, have good marks, and it's not too difficult to get into a medical school. And obviously, when you're there, give it your best. And but I think my path has been more about the passion to make a difference. And so even along the way, the decision to finish my master's and PhD, I've done other things, courses on leadership, international health, and this was all in me, for me, trying to find my space in all of this, because I realized that it's not as simple as specialize and this is what you'll become for the rest of your life. But I specialized, and I felt, I don't think I've arrived. I don't think this is it. This is not what I had in mind. And so in pursuit of, I guess, what I'm doing now, I tried a lot of things along the way. And so I also do a lot of mentorship as well. And I think that's, it's important for people who want to follow a certain path, at least get mentors and people that have gone down that way. Then you won't spend your time registering for all sorts of degrees that you probably don't need to go through. You can take a much shorter path to get to where you want to get to.
Awesome, awesome. Thank you so much for your time and the work that you're doing. I really appreciate this conversation.
Thank
And if you ever need a media platform, if you have upcoming projects, like don't be afraid to reach out. I support what you're doing, and I'm definitely going to be thinking of ways to help and to become an advocate for women's health, become a better advocate. So like, thank you for that. Thank you for sharing what you're doing.
Thank you so much. Thank you very much for this.
You're very welcome. And just one last question: if somebody, I hear the kids, if there's an entrepreneur, if there's somebody that wants to reach out to you, wants to pitch you a project idea, or just share some information, how would they do that?
So I'm not too difficult to find. I'm on LinkedIn, Twitter, Facebook, Instagram as well. So, and yeah, so you can find me on any of my social media accounts. Direct message me, inbox, and I'll send you my email address, and I'll make time to talk or discuss it over email. So I'm not too, So Salome Maswime on Twitter, Mrs. Maswime. But I'm pretty easy to find.
Awesome, awesome, easy to talk to. Awesome, thank you so much, Salome.
Thank you.
I appreciate your time. I'm going to wrap up the show, but it was a blessing to meet you, and let's keep in touch.
Thank you so much.
You're very welcome. Now, I know y'all like that interview. Got some good information and really just perspective of, particularly if you're American, the health system that we have. We complain a lot about America, but we have a lot of things going in our favor. And so, one, we have blessings that we should take advantage of, but then also we have work to do to become better humanitarians on this planet. And it is World Humanitarian Day. So shout out to all the people that are actually doing work to help their community and society. And this is our final mentorship call of the day. I hope you enjoyed it. Today we were in Namibia speaking to a female miner, digging up gold and diamonds, and she's looking for an investment. And right now we just came from South Africa, speaking with a global surgeon who is advocating for women's health and just how to make surgery better for people, women particularly, but people in general. I lost my aunt a few years ago. She had a double lung transplant and did not make it out of the hospital. So I understand how important surgery is and healthcare is, and life is precious, and so we want to protect it for all people. So thank you so much for your time. This is Mentorship Call. I will see you tomorrow. You know I got interviews. I'll be all around the world, y'all. It's your girl, Monica Seckman Grant. Peace and love.